Hi, I'm Dr. Christopher Bunick, Associate Professor of Dermatology at Yale School of Medicine and Editor-in-Chief of Dermatology Times. I'm here in Denver, Colorado at the American Academy of Dermatology annual meeting, and it's a pleasure for me to be here with Patrick Burnett, a friend of mine, as well as a really amazing dermatologist. Patrick, could you introduce yourself for our audience?
Yeah, hi, I'm Patrick Burnett. I'm a dermatologist. I practice in Chatham, New Jersey, but most importantly, I'm the Chief Medical Officer for Arcutis Biotherapeutics.
And here in the late-breaking session at the AAD, Arcutis is presenting new data on Roflumilast in ages 3 months to 24 months. Patrick, what can you tell us about this new pediatric data of Roflumilast?
Yeah, we're really excited. So Dr. Lawrence Eichenfeld presented the data from this new study. This is an investigational study. So we're approved in ages 2 and above with a 0.05% concentration. So we're studying the same concentration, but now, as you mentioned, in very young patients, age 3 to 24 months. We had 101 patients. And most importantly, just thinking about the safety, because as you think about these young children, it really is about the safety and tolerability. So our safety and tolerability profile really looked very, very similar to what we saw in the 0.05 in the older patients from ages 2 to 5. And then in this age group, you really are trying to also understand how it is that patients are responding symptomatically, but they can't tell you. So we were looking at caregiver type endpoints. So importantly, when we ask the caregivers, how long did it take for them to respond in their itch, which is the most important symptom for atopic dermatitis, half of the caregivers said that they responded in 10 minutes. So that's really an important kind of quick response to the patient's key symptoms. And then also when we just look at the overall efficacy, what we saw is that at 4 weeks, which was the endpoint, the primary endpoint for the study from an efficacy standpoint, we had 58% of the patients who met an EASI 75, which is a 75% improvement from the time that they came into the study. So here we're thinking about an area where there are very few new approved drugs in these young patients, not a lot of choices when you're treating them, and a lot of the patients end up on topical corticosteroids. I'm sure if you've seen in your own practice, there's a lot of pushback coming from parents when you're trying to get them to get adequate treatment of their patients, and they're a little bit resistant to the treatment options.
So this is really exciting. Roflumilast being very effective and safe with rapid control of itch in ages 3 months to 24 months. This really opens the door for continuing to advance non-steroidal topical therapies in pediatric atopic dermatitis. Beyond this late breaker news for Roflumilast, is there anything else Arcutis is working on that you would like to share with our audience?
Yeah, absolutely. So importantly for us, the next step is to take this investigational data and then bring that to the FDA. So we're planning to submit this to the FDA for approval to try and get this medication to patients as quickly as possible. Our intent is to do that in the second quarter of this year, so not too far off. And then as we kind of broaden out and talk about new indications for Zoryve in general, we're really thinking about hidradenitis suppurativa and vitiligo are two studies that our medical affairs research studies are being conducted in right now. And we're going to contemplate whether or not those might be potential future indications for Zoryve down the road.
So there you have it, Roflumilast and more at the American Academy of Dermatology meeting in Denver, Colorado. Thank you, Patrick.
Great to talk with you, Chris. Thanks.